Hi guys, it's your girl Dr Taiwo. Welcome to Oyinbo TV. If it's your first time, consider subscribing. The red button down there. It's a very lovely Saturday afternoon. Unfortunately, we haven't got much sun today, but we are managing the weather like that. You know how British weather is like. It's like a pregnant woman, always changing by the minute. So I'm with my friends today, my family friends, and we are talking all things depression. A lot of people have said, talk about depression. I'm not an expert. I'm not a clinical expert, but I have people who have the knowledge, so I've come to meet them. So we are doing grill. We are doing grilling chicken and talking depression. So I want to introduce you to, this is Dr. T. I call him Dr. T. He's my friend's husband. He's a clinical psychiatrist. Dr. T, tell us, there's a lot of people that experience depression in this country and in Nigeria as well. So what causes depression?
Okay, before I answer that question, I will just tell you, give you an insight into the burden, the health burden, global health burden of depression.
Right.
According to WHO, depression comes second in terms of the global health burden, behind cardiovascular problems. Cardiovascular problems refers to things like hypertension, heart disease, and other
you have to use layman terms that we can understand.
Yes. So depression,
all those medical terms might not flow with a lot of people.
The health problem caused by depression comes second worldwide to that caused by heart disease,
right, or
high blood pressure, and so on and so forth. So depression is a I would call it a clinical iceberg, especially in our Nigerian community. Many people are depressed. But they've learned how to put on a facade. But depression, if it goes untreated for too long, will get worse and can lead on to psychosis. It means that the person will lose touch with reality, and people have been known to kill themselves because of depression. So
depression can actually lead to suicide.
Suicide is the biggest cause of suicide among adults, healthy adults, physically healthy adults. Depression is the most common reason for suicide. But suicide from depression is actually preventable if it is treated. Right.
Okay, I want to ask you a very important question, because we are Africans and we know how religious we are. So for most Nigerians or people who come from African background who live here in the UK or anywhere in the diaspora, the first point of contact or the first point in anything that we're going through is, turning to religion, which is good, because religion does offer some comfort.
Well, it does. It can be therapeutic as well, but there is a limit to it.
Some people say thinking can lead to depression, or when people experience like traumatic events, or when things are not going well in somebody's life, it leads to depression. Is that correct?
Yes, it can potentially. There are many reasons. Should I talk about the possible causes of depression, like you asked earlier?
Okay. Yes, please. Yes.
Yeah. I will start with genes. Genes are the information that we inherit from our parents.
Right.
We all have genes now inside ourselves.
Right.
Okay. They dictate or decide what our life will be in terms of our health, even your achievements educationally. Genes are even linked to criminality.
Really?
Yes, you can inherit the genes to
So genes are strong like that?
Oh yeah, they are that strong. Yes.
Oh my
so
God.
If you have genes, if you have parents or grandparents who suffer from depression, that puts the children at risk of depression as well.
Wow.
And also the grandchildren. So the gene can be passed on in family, okay? But gene alone may not explain it.
Right.
There is the environment as well. So we talk of gene-environment interaction.
Right.
Okay. So that's one.
Okay.
In terms of environment,
stress,
severe deprivation, severe poverty, problems, crisis. So these are stressful situations in the environment that can add on to your genetic vulnerability. In other words, if you have the genetic irritability for depression, that makes you vulnerable. You may have a friend who has gone through the same stress with you, and only that friend will have depression if they have the genetic vulnerability. You don't have it, maybe you don't have the vulnerability. So these are factors that can determine.
So I'm trying to understand your big grammar. So two people can experience the same event,
the same level of stress.
The same level of stress. One person will not experience depression, and the other person will experience if they have the gene.
Yes, the gene can make the difference. The genetic the genetic makeup of the person can make the difference. So sometimes people with high level of stress who don't have the genetic risk factors, they may go scot-free. Most people would actually not suffer depression from stress. But for those who will have it, it can be very terrible.
Okay. Before we go, before I ask you the next question, I want. Okay, go on.
I was talking about other causes of depression.
Right.
Things like substance misuse, alcohol. If you are drinking a lot of alcohol, or you are using drugs, certain drugs like cocaine, cannabis, popularly called marijuana, Igbo, heroin, ecstasy, speed, amphetamines. All these are psychoactive drugs that can cause depression. And what they do is to change the brain chemistry.
Right.
Now, there are two main happy chemicals in the brain. I will call them happy chemicals.
Happy chemicals in the brain. Please explain that.
One is, there are chemicals that mediate our mood, the way we feel in ourselves, how you feel good. Like you are feeling good. So that's why you're looking very bright and happy.
Thank you, Doctor.
I'm also feeling good, and that's why I'm doing barbecue.
You're doing barbecue for us.
And I'm enjoying it. So the chemicals that make us feel like this, one is called serotonin. The main one is serotonin. Is in the brain.
Right.
There's another one called noradrenaline. All in the brain. So if you have derangement in the functioning of these chemicals in the brain, maybe you don't have enough, or your brain is not recognizing them enough.
Right.
Or there's a breakdown in the biochemistry of the chemical in the brain. That can trigger depression. So these are the types of depression that we call biologically mediated depression. And they are very, very treatable with medication.
Biologically mediated.
They are biologically mediated. So the essence of treatment is to correct the biochemical abnormality in the brain.
Can you pray yourself out of a depressed situation?
If you have clinical depression, if it is clinical depression, biologically mediated, miracles can happen, but I would strongly advise you to ask your doctor to refer you to see a psychiatrist, people like me.
Okay, if somebody with depression, for instance, you are in clinic and somebody comes in and they tell you this is what they are feeling, and you diagnose them to have depression, what would be the course of action? I mean, what would you do?
It depends on the severity. If it's mild depression, what we call common mental disorder,
right?
Mild depression may be due to things not going right in your life. You can still manage without medication. Maybe you need counseling.
Right.
Talking therapy. So I can refer you to the psychologist, like I said earlier.
Yeah.
Talking therapy. They will teach you how to spin your thinking or modify your thinking in a positive way. What depression does is to it causes negative thinking.
Right.
So your pattern of thinking that was positive before, if you are a very positive person, you always see your cup as half full. When you become depressed, you see it as half empty.
Wow.
So little things you will magnify beyond proportion, and everything is negative. If, for example, you have a child and the child became is coughing now, maybe this child is something terrible is about to happen. And then another factor is anxiety. Depression and anxiety are the same condition, an illness with I call them two sides of the same coin. Anxiety and depression go together.
Do you know what?
There are two sides of the same coin.
Do you know what, Dr. T? Before I came to this country, I didn't know that anxiety was an issue. That people can be suffering from anxiety.
Yes, stress.
I've seen
stress
it.
As well, stress related.
Anxiety is something that really distorts people's life in a way that if you have high levels of anxiety, it's difficult to have a happy life.
It is. And if the anxiety continues, the depression too will start.
Will follow.
Let me explain what depression actually means. Depression is not sadness, you know.
It's not sadness.
People yes.
Because
what do you think? Do you think it's sadness?
Doctor, the thing is that
we all get sad from time to time, but it doesn't mean we are depressed.
Yeah, my own understanding of depression is, continuous sadness. If you are sad for a long time, you can't shake it. Yeah. That means you are experiencing depression.
It does make sense. Yeah, you are getting there.
Right.
But there's more to it than that.
Okay. What about when people cannot get out of bed? They don't have any motivation to get out. They just want to remain. They don't want to even engage in life.
Yes.
Basically, even to stand up to go and have a wash is wahala.
Yes. You're onto something there. These are some of the features. Clinical presentation of depression. The features you will see, the telltale signs that this person is probably depressed. For example, if you used to enjoy boys, for example, talking about boys, if you used to enjoy, or men, you used to enjoy watching football, going out with your friends, chatting with your friends, you used to enjoy watching TV programs. As a woman, you used to enjoy making up.
Yeah.
You enjoy chatting with your friends. You enjoy even gossiping. It gives you pleasure. You enjoy, what else do you enjoy? You enjoy going to party. Gives you pleasure. And then suddenly, even party, you are the heart and soul of the party. You used to be the heart and soul of it. Suddenly you are reclusive.
You are withdrawn.
They are inviting me. Let's go to a party. There's party. So I don't know. I'm not interested. It happens one, second time, third time, fourth time. There's something wrong with that person.
Is it possible to be depressed and the person will not know?
Oh yes. Initially, you may know. You will know initially. But if it can become so severe that the person loses touch with reality, and then he doesn't know again.
Well, explain that, losing touch with reality.
That means that these are people with severe depression with psychotic symptoms. Psychotic symptoms are symptoms that indicate that the person has lost touch with reality. People can be so depressed to the extent that if you slap them in the face, they tell you, well, I deserve it. Should I? What can I do about it? It's my fault now. I deserve it. And if not because I was stupid, I won't have provoked the person to slap me. In fact, I feel sorry for the person I provoked. It was my fault. Wow. See, what that is telling us is that their pattern of thinking is changing, is negative. They are even expressing guilt. I will call it delusions of guilt. That is not out of context. That has no psychological or psychological basis for it. There is no. It's not real. You feel guilty for what you have done, but in this case, they are feeling guilty for what they have not even done.
Wow.
So that is an abnormal situation. It's a severe depressive state.
Wow.
Another example of psychosis is that they can start hearing voices.
Yeah. Telling
them that passing negative comments about them.
So
that
depression,
you are a hopeless person, and they will start to believe it, that they are hopeless, that they are useless, that they are unworthy of anybody's affection.
So can depression lead to psychosis?
Oh yes, if it is severe.
If it's severe.
Severe and prolonged enough, it can lead to psychosis. But even then, you call it psychotic depression.
Right.
Even that, it is still treatable. You don't go to a church and start praying. Because the longer it goes, your brain cells are going. The longer it goes on untreated for, time is brain cell when it comes to depression and some other kind of mental illness as well. So time is of the essence. I'm not saying people should not pray. I'm not saying that. What I'm saying is that see your doctor.
You should get help.
The doctors are not babalawo. They are not going to put incantations on you. I mean, it's so bad. I've seen people, instead of seeking medical treatment, they go to traditional healers who will give them all sorts of herbs.
Yeah.
And they put scarification marks on their body and tell them they are cured. In fact, I've seen some traditional healers who will go to the instead of say, you go and do sacrifices. Some will even go and buy these drugs that the doctor will prescribe and crush it and mix it with herb and tell you to drink it.
Okay.
Without knowing what you are drinking.
We don't know what you are doing.
Yeah.
Why do you think Africans especially struggle to speak about it or to seek help?
There is a big issue of stigma. Stigma is worldwide. It's not only Africans, but it's worse with us Africans, including Nigerians.
Yeah.
Stigma is very bad, and it's preventing people from seeking the treatment and help that they need and deserve.
Yeah.
Even people that are entitled to treatment in UK, they have the full citizenship. Until it becomes unbearable, they don't seek help. Or until somebody else forces them or pushes them out, or they use the force of the law to enforce treatment, they won't come out of their home to seek treatment.
Can isolation, when somebody is isolated, because a lot of people are isolated here because of the close nature of the society, can it lead to depression?
Oh, social isolation is a risk factor for depression. Not only for depression, but for psychotic illness. Social isolation. And then there is research evidence that has proven to us that the closer you are to people that are close to you, to your background, to your community background, to your race, your community life, in terms of your ethnicity, language you speak, the closer you are, or the country of origin, the closer you are to them, the more protected you are from mental illness in general. And the opposite is true. The farther you are from your socio-ethnic background,
Right.
the higher the risk of suffering of any form of mental illness. So if you are living, for example, if you are a Nigerian Yoruba man or Yoruba woman, you are living in isolated rural part of Scotland, you are at a higher risk. I'm not saying you leave Scotland.
I was saying a few days ago that I want to retire to a small village. That means I will be putting myself at risk.
You can bring people like us with you, your friends, and then you have a little party.
We'll have a little party. We'll get together. And you know, these
there.
people, that's Ronke there. I didn't show Ronke before. That's his wife there, my bestie. These people can have party. They know how to say, entertain. Not party, but entertain.
I like doing barbecue.
Dr. T is doing barbecue now. He does it all the time, and they always entertain. Now I see why you guys entertain. So it's actually very, very therapeutic.
It is very therapeutic.
Right. I didn't know that. I did not know that. So what's treatment? Treatment.
Let me quickly make this point before we talk about. I mentioned this to you earlier. Before I go, it's part of the treatment, but a way of knowing. There's something I was telling you about, Bridget, about psychological stress bucket.
Right.
Yes.
That's really interesting. I want to learn about it.
Psychological stress bucket. What does that mean? We are using bucket as just an example. If you fill bucket with water.
Yeah.
If the water is bucket is three-quarter full with water, how much more water can it take?
Just a little.
Just a little more.
Yeah.
So similarly, if imagine you have your stress, you can put them in a bucket.
Put them in the bucket. Listen to this.
When it gets to 75% level or 80% or more, or around that level,
yeah,
the question you ask yourself is that how much stress can I take before I tip over?
Wow.
You understand that? So, and then if your stress bucket is almost empty, there's little. That means that you can probably take more stress than somebody whose own is almost full.
Right.
For example, if you get to work, if your stress level was so high by Sunday night, and you get to work on Monday morning, and you are a doctor or a nurse or an accountant, or a social worker, or a school teacher,
and you get one miserable email like that,
or a carer, or even a politician, and somebody says a little thing that it can be annoying to anybody. If your stress level is very high, you find yourself, your response will be beyond extraordinary. You will hit the roof. And then after, you wonder why did I say what I said?
Your bucket has
why have I been like this? Your stress level was so high.
Your bucket
what I call psychological stress bucket was almost filled up.
Right.
So that man filled it up for you, it was overflowing. And then you lost control.
Right.
So people with depression go through this as well. They go through it. Then the last straw, when the last straw comes and breaks their back, then they go into full depression. So depression is actually, if it is not biologically mediated, if your environment is okay, or you haven't got the biological risk factors for depression, and you are facing a lot of risk, if you can manage the risk, or the stress factors around you, and manage your stress level, don't bite more than you can chew.
Right.
Know when to rest.
Well, please expatiate on that biting, because
biting more than you can.
We Africans, we are chasing money. All we are looking for is money.
Money is good, but money does not give happiness. Yes. If you are biting more than you can chew, some people I've seen people doing three jobs.
Did you say money does not buy happiness?
Money cannot give you. But well, we've seen millionaires committing suicide now. What does he want to know?
If I say that, they will tell me to shut my mouth.
Millionaires commit suicide in UK.
This is coming
not
from
only
the
UK,
psychiatrist.
across Europe, in America. Millionaires commit suicide. In Nigeria, we know of big time farmers who commit suicide. They drink gamalin. Not that they are poor, but something went wrong in their lives.
Right.
So suicide is common, but it is preventable. But most suicide is due to depression. I'm not saying everybody who committed suicide was depressed. No, but a lot of people who committed suicide were depressed. They had untreated depression.
Right.
Even some were treated, but treatment was not adequate enough, or maybe they were not even complying with the treatment.
People are afraid of medication. They don't want to take medication. Sometimes that's why they don't seek help. Because they're worried that they'll put them on this medicine that will make them become so docile, and they won't be able to function properly. And another fear is that once you get on that medication ladder, there's no going back.
I can address that.
Okay.
You want me to address it?
Please.
Okay. Now, depression has various types of treatment. If it is mild or moderate, we usually recommend talking therapy first.
Right.
Okay. But once it becomes moderate to severe, your thinking is so damaged that the psychologist cannot even get to you again.
Right.
What they are saying will not make meaning to you. Your concentration will be so poor, you can't follow the discussion. Because the psychologist also give you homework, some assignments to do. For example, if he's using the modality of treatment called cognitive behavior therapy.
Right. We did that one. You studied that one.
Yeah, you studied it. I'm sure you forgot enough of it. So you need to be able to concentrate, follow discussion, follow instruction, and follow the interpretation of your symptoms,
right.
The psychological interpretation of your symptoms with the psychologist, because they be explaining all this to you.
Right.
And then the changes to your thinking pattern that has been visited upon you by depression, the psychologist will help you to think about it and reflect upon it, because you probably wouldn't even know, or somebody brought this up with you. And this is what psychologists will do.
Right.
Psychiatrists who can do it, but we often don't have the time to do it.
You don't have the time because you're too busy.
But psychologists do it day in day, like it's their bread and butter. They are even better at it than us. Okay. So that is what we do. We help you identify your negative pattern of thinking. And the negative pattern of thinking is a vicious cycle. It gets worse until it is broken.
Right.
So the role of the psychologist is to break that cycle. And it's also linked to anxiety. Let me give you an example. If a lion comes in here now, me and you and all of us here, what will we do? We are going to jump over the fence.
We will take off.
And we run. We run. Or if somebody comes out with a gun,
we will take off.
And or if we hear gunshot suddenly, we all run into the house and escape.
Yeah.
That means that's called a flight, fight, or fright reaction. Okay.
Flight reaction.
Flight. We are going to flight. Our own is flight, but the other one, flight is either flight, fight, or fright.
Right.
If you can't escape, you fight.
Okay.
For example, if somebody suddenly holds me down and they want to shoot me, my only way is to fight. Even if I get killed eventually, I will still fight.
At least you fight for your survival.
Yes.
Yeah.
The third reaction is called fright. That's like it's like giving up. You become helpless. You just adopt that helpless role. Passive. Oh, yeah, this is my head. They cut it off. It's like you freeze.
You just surrender.
You surrender immediately without even. Yes, you surrender immediately even with very little threat around you. That's fright. And that kind of reaction is common in people with depression and anxiety. Okay? And they are in a constant state of fright.
Oh my God.
You understand? When there's nothing to be afraid of, they are constantly worried. Anxiety is fear. It means fear in common language. Wow. Fear, worry. That's what anxiety is about. So when you're anxious, without anything to explain it, that means that you have an anxiety disorder. And it goes with depression. But it is also treatable. Either psychological means if it is not severe, or by medication.
Right.
Now I will go to the issue of medication that you have raised.
Right.
Yes. So that's why it's important to go to a properly trained specialist for treatment. Antidepressants are safe. They are very safe. I will prescribe it for myself if I'm depressed. I will take it. In the last 25 to 40 years, I will say, since early 80s, there has been new drugs that came into the market with very, very safe profile, acceptable side effect profile. There is no medication that has no side effects.
Yep, that's true.
Some has side effects.
Yep.
If you drink too much water, it will give you side effects.
Benny.
So sometimes your side effects are something that we have to trade off.
Yeah.
But they are not bad enough to stop you from functioning. You will not become looking like somebody who is who has been battered or looking dull or something like that. No, it doesn't. If you have been given the right medication that suits your own presentation, it is the duty of the psychiatrist to work out the type of medication you need,
right,
and one that will suit you and agree with you. Then you try it. If one doesn't work, there are other ones you can try.
Right.
Unfortunately, we still don't have a biological test to determine which medication works for Mr. A or Mrs. A, and which one works for Mr. B or Mrs. C.
So you have to keep
we
trying
have to
the different ones until you find the one.
Yes.
Right.
Sometimes you have to try. But by and large, most of them work in the same way. They boost that chemical I mentioned, serotonin and noradrenaline, those two chemicals. Serotonin is the main one, then noradrenaline. So that's where the medication works. The only difference between them is the side effects.
Right.
Some will make you feel sleepy, some will not.
Okay.
Some will make you feel alert.
Okay.
And then a note of warning. If you think you can go and buy antidepressant in the market in Nigeria without proper diagnosis, you are risking your mental health. Okay? Because anybody who is sad and use antidepressant, you become manic. And when you become manic, I don't like using the word madness. It's like madness. Mania. It's called mania. Mania is a major mental illness. So don't go there at all.
Don't go and buy medicine except it's prescribed, because it's free in the open market.
People that are having running chemists in Nigeria, please stop selling antidepressant in the open market for people. It is an ethical drug. It's a prescription medicine. Even not even all doctors have the confidence to prescribe it. It is those who have been trained to prescribe these medicines that should prescribe it. I will not prescribe what I was not trained to prescribe.
Right.
There are some medicine I'm not too confident to prescribe. I do I'm a medical doctor, but I can't treat everything. I can't treat certain conditions.
Right.
Some certain heart conditions. I will look for a cardiologist.
Right.
To treat it.
Yeah. It's not one for all.
No.
All for one.
There's no jack for trader.
Jack of all trades. Gbogbo nishe. There's no gbogbo nishe.
Okay.
So, Dr. T, one final word from you before we end this. If somebody is watching me now and they're experiencing all these symptoms that we've talked about, what we've been discussing about, feeling, not having the motivation, feeling perpetually sad, being in a place where they don't care, not sleeping,
no appetite,
not even having any joy.
When their best food is in front of them, they can't even eat it.
You can't even take joy in anything.
They don't enjoy the food.
Yeah.
These are evidence of depression.
Right.
And then they what they used to enjoy before, even sex, they can't enjoy it. Man or woman, they can't when they're depressed.
Yeah, it's true. I've heard of women who complain that their husbands are suffering from depression, and because of that, it's really affected their relationship.
Even women, some women have postnatal depression, and when they have it, the husband is very frustrated because the woman is not interested in sex.
Yeah.
And she's just stressed out. She's depressed. But it's like punishment for her when she's depressed.
Yeah. So one person that is watching out there now, listening to you, what would you say to them if anybody watching out there, because obviously, so many people that are watching now will be experiencing one or two of these symptoms that we've talked about. What would you say to them?
Yes, I want to say to them that look, nothing must stop you from seeking help that you need and deserve. The most important thing that you need to remove, jettison, put away from your mind is stigma.
Right.
Don't worry about what. Don't say what will people think. What will my friends think? I'm going to say psychiatrist. I'm going to say I have depression. Forget about that. Thankfully, in the Western states, in the Western culture, stigma is being gradually destroyed. But it's still a big issue in our culture.
It is.
But I want to encourage you to seek the help that you need.
Right.
You may not know it. 1 in 4 people on the streets of UK is on antidepressant. Right. 1 in every 4 person from all race and creed in UK. At least I can speak. I practice in UK. I'm a psychiatrist in UK. I can speak about UK. 1 in 4 person on the street. In fact, it's almost 1 in 3 now on our streets has depression, and they are medicated for depression, and they are functioning very well. Yeah. This includes multi-millionaires, bankers, doctors,
in fact,
doctors like myself, even psychiatrists, nurses, teachers, politicians. Members of royal family across the world. Right. Depression does not respect royalty. Sadly. It doesn't respect medical degrees. It doesn't respect PhD. It doesn't respect wealth. Okay? So if you want to get better, get back to the treatment from the appropriate source. Right. Appropriate, the person that is trained, medically trained, to diagnose you and give you the right treatment. You will get better. Usually, antidepressants don't work suddenly like a painkiller. It takes time. Right. The fact that you started antidepressants today, and then 2 days after you're still the same, don't worry, just keep taking it. Right. It takes time to kick in because it's a chemical. The chemical changes in the brain take time to feed through. Right. The brain is very complex. Up till now, we don't know everything about the brain. Right. We are still studying the brain. Right. The brain is the most complex organ in our body, and if as complex as it is, we expect to function to the day without any problem. We are deceiving ourselves. If less complex organ in our body, like kidney, like lungs, or the liver, or the heart, can have problem, that we treat with medication. Yeah. What gives us the right that the brain will not have problem? Brain. As complex as it is. Yeah. What gives us that idea that the brain must work perfectly? I wish it does, honestly, but it doesn't. Yeah, it doesn't. Yeah. It can cause problem. Problems will arise. Yeah. That reminds me. It's so important. And I feel so strong about it because in Nigeria, when people suffer major mental illness, for example, schizophrenia, or mania, like that I mentioned earlier, mania, these are people that you will see maybe eating on the refuse pile. They may be naked, a beautiful man completely naked. That's mania. Schizophrenia too can cause it. They're hearing voices telling them they are lost in their world. They are not witches.
So it's those ones we see on the road.
Yes.
Those mad people.
Yes.
They see on the streets
and
in
dementia
Nigeria.
too can cause psychosis.
No, I've always wondered how come we have those mad people in the streets in Africa. We don't have them here.
Because over here, the difference is that we respond quickly. We help people a lot here. The society here is
Tolerant.
Is very not just tolerance. There's service to help people.
Yeah, but even in the hospital, even the psychiatric hospital in Nigeria have very negative
attitude
reviews. Yeah, they chain people and they treat people in such barbaric ways that you will never think of doing today.
It's because of inadequate resources. They don't have enough resources.
That's why they have to be chaining people.
It's very bad. It's horrible. It's
How can you chain somebody? It's a hospital. Not Babalawo.
Somebody who needs help. It's punishment. You are punishing them. You are adding to their problem. You are putting fear in them. They will leave the hospital with post-traumatic stress disorder. After you have treated their depression or psychosis, they will have PTSD, post-traumatic stress disorder. So I think it's very, very bad. So talking about stigma, because of stigma, families have been known to pick up their loved ones who have major mental illness, drop them into remote bush and dump them in the bush. And then, for example, somebody will drive from Ogun State, I'm not saying Ogun State, or from Oyo State, or from Anambra, and drive to another state, drive like 500 miles to another state.
So that they will not give them a name.
At night, and dump them in the middle of nowhere, so they won't be able to find their way back home. And when you're mentally unwell, you cannot, your brain is no longer functioning, you cannot think properly again, your intelligence goes. So such people do not find their way back home unless they find people that are going to help them. So it's very bad, and that's why it's important that we should all not only remove the clothes of stigma from our body, we should burn it. Burn all the clothes of stigma of mental illness. Because mental illness, maybe it's the way we call it. Maybe we shouldn't be using that word mental illness.
Even here, that's what they call it.
Yeah, you call it mental illness, but maybe people find it sounds a bit derogatory. But just like, you know what I said earlier, just like your stomach can have problem, your intestine can have problem, you start having diarrhea, or even cancer inside your intestine, or cancer of the liver. So similarly, the brain can have problem.
It's a brain problem.
You have cancer of the brain. And there are also physical illnesses that can cause some mental illness. And that's why you need a properly trained doctor who is a psychiatrist to attend to you, because everything is not just in the brain. Sometimes problem in one part of the body can cause problem in the brain. For example, problem in the thyroid gland in the neck can cause problem in the brain and manifest as mental illness.
Thank you so much, Dr. T. I really appreciate finally having this sit down. We've been planning it for a while. Thank you so much. And thank you, Madam Ronke, for the grill.
She's learned.
She's grilling.
She's my trainee.
Thank you so much for the grill and for the chat about depression. So guys, there you have it, coming from the expert. I don't have much. I mean, like I told you guys, those who send me emails and say talk about depression, I said, well, usually I don't have all the knowledge, so I seek out the people who have the knowledge. So he's an expert. This is his area of specialty, and he's practiced for many years. So he's giving you the lowdown on depression. So please, if you need help, seek help. Oh, please seek help. You can still pray to God and go and get the help that you need. Don't suffer in silence. And I'm just going to leave it here.
Not just prayer alone.
Not just prayer alone. Seek professional help. Go and see your doctor and get some help. So I'm going to leave it here. Today, I hope you find this very, very informative. I've learned so much today. So much. That bucket thing.
We regularly see pastors who bring their church members to our clinic for treatment.
Doctor,
pastors, yes.
Pastors.
They've kept them in the church praying non-stop, and then it has gotten out of control. And because they are lost there, so I don't get into trouble, they now bring them for treatment. So please.
Oh, Dr. T, I can't laugh.
And it's the truth now. I'm a Christian, so, but I have to say the truth.
He said the truth. They kept them in
the
church.
What is wrong. There is no other name for it. I don't agree with that kind of practice.
Okay.
It's abuse.
It's
Let's call it what it is. It's abuse. Okay. If the pastor is doing that to you, he's abusing you.
It's abusing you. If he's keeping you in church, I don't allow you to seek help. Please go to a doctor. I'm begging you. Don't go to doctor and get a proper diagnosis. You've heard it. It's a sickness of the brain. It's not something that you just be praying. You can pray, but seek professional help. Let me just leave it here. I'll catch you in my next one. Be sure to like and subscribe, and we'll keep the conversation going in the comment section. Thanks for watching. Dr. Say bye-bye.
Bye. See you next time.
Say bye-bye. Bye.
We believe in God the Father. We believe in Jesus Christ. We believe in the Holy Spirit.